Asthma is a common medical condition which will result in the airway obstruction. This disease affects around 300 million people worldwide nowadays, and the number of patients is estimated to increase by 50% every decade. Airway refers to the breathing tubes which will carry air into our lungs. Most of the time, asthma patients have no issues in their breath. However, due to the fact that the airways in their lungs will periodically become narrower, people with asthma may find it harder to breathe in and out, just like trying to breathe using a thin straw. Nowadays, the biggest challenge to cure asthma is that different patients may have different causes, although their symptoms can be categorized as asthma. The common symptoms include chest tightness, wheezing, and coughing, and the cause of those symptoms can be airflow obstruction, inflammation, or hyperresponsiveness in the airway. There are lots of short and long-term medications available to help relieve the symptoms. However, as of now, there is no way to eradicate the root of asthma. Along with the medication, more and more research was increasingly emphasized on the genes associated with asthma, and finding a way to fight with the negative effects of these genes will be the goal of those researchers. It is believed that ORMDL3 gene might be closely related with most of the symptoms of asthma. In most asthma patients, the effects of ORMDL3 gene are overexpressed, which means that, compared with people without asthma, the ORMDL3 gene is more active in asthma patients' bodies. Based on the scientific research, ORMDL3 is believed to be related with the airway hyperresponsiveness, which is a crucial cause of asthma. As we know, the opening and closing of the respiratory tract is controlled by the airway smooth muscle. Those muscles are considered as a type of involuntary muscle, which means their action is not controlled consciously by our brain. Other examples of involuntary muscles in our body include cardiac muscle and smooth muscle lining the intestinal tracts. Since those muscles are not under our conscious control, their movement will be mainly affected by some instinctive actions. When some irritating foreign substance is detected around, the airway smooth muscle will instinctively contract and narrow the airway to prevent more harmful things from entering the lungs. Compared with normal people, asthma patients' airway smooth muscle will contract excessively, which will result in the airway obstruction and other asthma symptoms. In the airway smooth muscle, the drasticity of the contract action is believed to be determined by the level of lipids in smooth muscle cells. ORMDL3 gene is an important factor responsible for the regulation and distribution of these lipids. If ORMDL3 is overexpressed in our body, the distribution level of lipids might be unbalanced, which may cause the overreaction of the airway smooth muscle, and all those asthma symptoms will appear. The aim of some research is on finding a way to counteract the ORMDL3's overexpression and rebalance the level of lipids in the muscle, and thus relieve the symptoms. As of now, some drugs which can help counteract the effects of overexpression are being tested in preclinical studies, and hope they can help asthma patients live their lives with less worry about those symptoms. Thanks for watching. If you liked the video, please hit the like button or subscribe button for more interesting topics.